Hi guys, Andrew here from Optimal Wellness Chiropractic. Today I wanted to talk about sciatica, or in particular sciatic nerve pain. Now, sciatic nerve pain is caused by pressure and irritation of that sort of sciatic nerve. The sciatic nerve is the largest nerve of the body. It is a nerve that originates in the lower back. It stems off and actually runs through some pretty big gluteal muscles, travels down the back of the leg to the actual sort of knee. At the knee, it splits into two parts. One part travels around the front of the leg, down to the front of the leg and top of the foot, while the other travels down to the back of the leg to the back of the ankle. Now, when the sciatic nerve is irritating, it can be very painful, giving off sort of electrical sort of searing pain to wherever that sort of sciatic nerves. It may be just in the lower back. It may go down into the backside, but it also could travel down to the knee and down to the ankle as well. We find that 9 out of 10 cases, sciatica can be caused by irritation or problems within the lower back. Things like disc issues, putting pressure on the nerve root, or wear and tear in the spine, or even problems with the way the joints are actually sort of functioning. In a large number of these cases, we have great success simply by re-establishing normal mobility and normal function through that lower back. In about 10% of cases, sciatica can be actually caused by the tight glute muscles in which that sort of nerve actually runs through. So what I wanted to do today is just show you just a few stretches that you can do to help relieve that sciatic pain caused by those sort of tight gluteal muscles. Knee to opposite shoulder stretch. Now, this is a simple stretch that helps relieve sciatic pain by loosening your gluteal and piriformis muscles, which can often become inflamed and press against the sciatic nerve. Now, first step, lie on your back with your legs extended and your feet flexed upwards. Bend your right leg and clasp your hands around the actual around the knee. Gently pull your right leg across to the body towards the left shoulder. Hold it there for about 30 seconds. Remember to pull your knee only as far as it comfortably will go. You should feel a relieving stretch in your muscle, not pain. Now push your knee so that your leg returns to the starting position. Now repeat this for about 3 reps and then switch legs. Stretch 2 is the sitting pigeon pose or adapted pigeon pose. Look, the name is derived from a yoga move. I've adapted it to be done in a chair as well. You sit on a floor or a chair with your legs stretched or bent in front of you. Bend your right leg, putting your right ankle on top of your left knee. Lean forward to allow your upper body to reach towards your thigh. Hold for about 15 to 30 seconds. This will actually stretch the gluteal and actually lower back. Repeat a couple of times and then do it again on the opposite side. Stretch 3 is a spinal curl. Simple stretch, lay on the ground. You can either do it grasping both knees at once or one knee at a time. You grasp your knees, flex your head forward, and just hold that curled up in a ball position for a period of 10 to 30 seconds. This is designed to open up the disc spaces and joints of your lower back. Repeat it 3 times. Now the final stretch is a simple hamstring stretch. The thing with this is I like to do it sort of sitting on the ground with one leg at a time. Flex your foot so your toes and legs are sort of straight. If you find your knee tends to hyperextend, just keep it with a slight bend. Bend your body forward slightly towards your foot. The further you go, the deeper the stretch. Now don't push past the point where you actually start to feel pain. Hold it for about 30 seconds, then ease, do 3 reps, and then repeat on the other side. Please note that these exercises will effectively give relief from sciatic pain caused by those tight gluteal muscles. If you find that this doesn't give you relief, or you get a reoccurrence of the same problem, then it might be likely that the cause is actually coming from the lower back. In this case, I'd encourage you to sort of see your chiropractor just to assess your lower back and see if there are any issues with the functioning or stability of your lower back that can be addressed without the use of any sort of drugs or surgery. As always, I hope you found this video helpful. If you did, I'd love for you to sort of share it just to help get it to people who may need this information. Any comments, just write them below and I'll personally get back to them. If you want a copy of my exercises, the ones that I give to my patients to help strengthen their spine, then look, click on the link below and I'll send them to you. Look, as always, thanks for your time. I hope you enjoy it, and I'll see you next time. Take care.